Hello, my name is Verch. I am a graduate of Bachelor of Arts major in Communication Arts, and I'm also a graduate of Emergency Medicine. So I chose this specialty because I am very much drawn to the fast-paced environment and patient outcomes. And emergency medicine kasi has an element of surprise. It's very unpredictable. Hindi mo alam kung ano yung mga pwedeng pumasok sa loob ng emergency room. May it be a mass casualty incident, multiple trauma, or a dog bite. So, hindi siya nagiging routine. And as someone who struggles before, kung ano ba talaga yung specialty na para sa akin, emergency medicine kasi has a little bit of everything. So, pwede siyang trauma, pwede siyang for surgical, pwedeng medical, pwedeng adult and pedia. And I think I just like the fact that anywhere or whenever, wherever, kung nasaan ka man, as long as there is emergency and a medical attention that needs to be addressed, I can help. 3 words that can describe my emergency medicine residency life. I think number 1 is it's very fast-paced, no? So, mabilisan ang galawan sa emergency room. Number 2, it's unpredictable. And then, number 3, it's toxic in a constructive and learning way, no? So, we have to embrace it. Yun talagang trabaho natin as an emergency room doctor, to thrive in toxicity. A typical duty day starts with endorsements, no? So, meron kasi kaming dalawang shift sa hospital namin. Meron kaming AM and then PM shift, no? So, we will endorse, especially from the previous shift to the incoming shift, yung mga patients na pwedeng ma-carry over or yung mga patient na nagsistay pa sa ER kasi may mga hinihintay pa regarding the cases, kung ano man yung mga management na ginawa sa kanila, and kung ano pa yung mga hinihintay. And when it comes to handling patients naman, nagsa-start siya sa triage with our triage officer, checking each patient na dumarating sa ER according to their shift complaint, and then we will classify it into 5 in accordance to the emergency severity index, with 1 being the highest, being the critical, and then with 5 being the least priority, no? So when these patients came in our institution or inside the emergency room, we will manage, we will stabilize it, or kung ano man yung deserve nila na management. And once all of these were done, pwede namin silang bigyan ng disposition, which is either to admit or discharge the patient, no? Especially yung mga ina-admit na patient, sila yung may mga needs ng further management na magbe-benefit kapag nasa loob sila ng emergency ng hospital, and then i-discharge naman namin yung mga patients kapag medyo naging okay sila, no? Ang usual duty hours ng mga residents ngayon ng emergency medicine is 12 hours. And I think almost every institution with emergency medicine works that way. Parang dahil nga ang mga residents natin nag-work sa very intense environments, kailangan nila ng work-life balance. Kaya 12 hours na siya, which I hope na sana maranasan din ng other specialties. I think the hardest part of the residency so far is the uncertainty of the workload, no? Kasi may mga times talaga na hindi mo alam na dadagsain ka ng patient, ganyan. Pero as an emergency medicine resident, we must be prepared at all times dahil hindi naman lahat ng araw kesyo benign ka, no? So may mga times na magiging toxic talaga, and sometimes may mga patients na dadagsain talaga ang emergency room, ma-overwhelm yung resources, pero you have to conquer all of those kasi yun talaga ang work natin, which is to provide immediate care to patients who need it the most, or para who need it at that certain period of time, no? And siguro one of the hardest part for me as a resident din is no matter how prepared you are or no matter how well equipped you are, there are times talaga na you just can't save everyone, and it hurts my heart, no? It's very hard. Sometimes di ka makatulog sa gabi kasi hindi mo siya na-save, pero you just have to realize na ginawa mo naman ang lahat, and it's inevitable. May mga times talaga na ganun talaga. Siguro the most rewarding part for me during the residency life is during the times na makita mo yung mga patients mo na nagiging okay. Previously, pagpasok ng ER, medyo nahihirapan sila, ganyan. Tapos na-manage mo, na-stabilize mo, napauwi mo, their smiles, ganyan, papasalamatan ka nila, nakakataba ng puso, no? Kasi you are giving them a chance to live or para to see another day or another tomorrow, no, together with their relatives and their friends and their families. Sobrang ano siya, nakakataba ng puso, and masasabi mo na pag uwi mo, kanya matutulog ka na, hey, I did a very great job today. So that's a pat in the back. So for everyone who is contemplating or parang wants to pursue emergency medicine in the future, I say go for it. Take the leap of faith and just follow your heart. No, it's true that we are working under intense pressure, very fast-paced environment, and emergency medicine is still young in the Philippines. It's still growing. Pero kasi there is this unique and irreplaceable magic when it comes to being a frontliner. No, we are the ones who are bridging the gap between patients' worst days and their chance to having another tomorrow. Just always think na we are trained to become the calm in the middle of the storm. So if you choose this path, you are not just choosing the specialty, you are choosing a life of absolute readiness. You will learn how to work with chaos and not to look at chaos as something that should be feared, but something to conquer and be peace with. No? And it will stretch you, it will test your limits, but it will also show you how strong you are. And if you want a medical career where you can be the immediate answer to someone's prayer anywhere or everywhere, embrace the chaos. Choose emergency medicine, and we are welcoming you, or we are waiting for you in the front lines.